as I say, we can return to this, and it is a topic you no doubt would like to speak about, and we'll take your calls after 2 o'clock. But we're all very health conscious nowadays. We know how important it is to treat our bodies right and make regular visits to the doctor. But unfortunately, many of us underestimate the importance of looking after our eyes. And what you do in your life can have an impact on the health of your eyes. As you know, I've recently discovered that I have a macular degeneration condition, and it has been a wake-up call. So I've been out and about trying to get information and advice, and one of the people that I bumped into and was able to help in launching his new specialist clinic is a fellow by the name of Dr. Neil Sharma. Now, he's a young ophthalmologist with special interest in cataract surgery, macular degeneration, diabetic retinopathy, refractive surgery and glaucoma management. And as I say, he's just opened his own clinic in Green Square, just south of the CBD in that fast-growing area. And he joins me in the studio right now. Dr. Neil Sharma, thank you very much for coming in.
Thanks, Chris. Thanks for having me in.
Good to see you in here. Fantastic. Look, generally speaking, do you think Australians are doing enough to look after their eyes, given the climate, the heat, and the landscape that we live in?
I think there is an increased awareness in this day and age compared to probably 20 or 30 years ago in terms of the impact of sun exposure and so forth. But certainly more can always be done. And we are in an environment where things like ocular melanoma, although they're not heard of very often, we are the melanoma capital of the world. And sun light and sun exposure can cause damage throughout the eye.
So melanoma within the eye?
Correct. So there is a condition called choroidal melanoma, which affects the inner or the middle layer of the eye. It's not very common, but we do see it in Australia, and we are sort of have higher rates than pretty much any other country in the world.
So I guess for someone healthy at the moment, with good eye health, they need to do some basic things. And I guess if you had to come up with the top 3 things you should do to look after your eye health, what would they be?
I think firstly a very obvious one is not to smoke, because in terms of macular degeneration in particular, there's good evidence to show that smoking, we know it's bad for other parts of the body, but it does affect the blood vessels that supply the retina at the back of the eye. And so number one would be to stop or at least minimise the amount of smoking and ultimately quit for good, because that does a world of good.
Right.
A healthy diet, green leafy vegetables, fish a couple of times a week, nuts and so forth. I think the message is sort of starting to get through to the community. I'm
now having so much fish, I'm starting to grow scales.
A couple of times a week is sort of generally what I say to patients. I mean, you don't necessarily want to overdo anything, but oily fish in particular is shown to be of benefit. So where possible, to try and get a diet that sort of is high in nutrient-rich fresh food and vegetables is always useful. And then number 3, I'd say, is sort of sun protection, sun exposure. We all sort of know slip, slop, slap. But studies, part of which I was involved in earlier in my career, shows even from the age of sort of 5 or 6 that children are starting to show evidence of sun-related changes in their eyes, and that can progress sort of throughout their life. So I think at any age, the message of not too much time outdoors in the bright sort of midday sun, and certainly wraparound sunglasses and so forth, are very important as well.
Even as a young person. All right, very, very important information. Now, after the information come the questions from our listeners. 131873. Dr. Neil Sharma will take those calls, your questions, right after this break. Yeah, this severe storm across the Central Coast from Maitland down to Wyong, quite incredible pictures. If you follow Facebook, you'll probably find them, but also most of the news networks are now posting these pictures. We might be able to get a few on our website as well, just from the Central Coast, and some of the incredible shots of snow covering absolutely everything. And we've also had a 4.8 magnitude earthquake, which has struck off the coast near Warrnambool, southwest coast of Victoria. No reports of damage as yet. And police are searching for a 5-year-old boy who's wandered off into bushland on the Sunshine Coast. The boy was last seen near his home at Rainbow Beach around 10:30 this morning. It's understood he has 2 dogs with him, a fully grown Ridgeback and a puppy. Anyone who sees the boy is urged to contact police. Let's hope those 2 dogs, who do look after kids, look after him as he conducts an adventure through the bushland, and let's hope that locals can find him quickly. I've got Dr. Neil Sharma with me right now. ophthalmologist, ready to take your calls. And Josephine, you've got a question for Neil. Go right ahead.
Yeah, hi. Dr. Sharma, I have retina pigmentosa, recessive. I was just wondering, with the research, I've heard about the bionic eye, but I don't see completely black. They did say there's nothing they can do for me and it wouldn't get any worse. So I haven't been back to a specialist for the last 6 years because he told me not to bother. Is there anything out there other than the bionic eye that might help? Because I think the bionic eye would just make me see what I'm seeing now anyway.
Correct. I mean, the honest truth is, retinitis pigmentosa, as you know, is a condition that affects the retina in certain individuals, and it can have a hereditary or family-linked component. It affects the peripheral vision to start with, but can lead to progressive visual loss. Your question about the bionic eye at this stage is correct in the sense that it's probably not going to be of use to you from what you're saying. The exciting news is that there is a lot of research being done on retinal conditions worldwide, and I've recently come back from a year in Cambridge in England, and certainly at Moorfields in London, at a few of the big institutes overseas, there is a lot of stem cell research that's going on that may very well provide some ability to regenerate or restore retinal cells that are no longer functioning.
So that sounds promising, but it is to come.
The truth is it's probably several years away, and I don't want to give you false hope that it's immediately going to be available in the next 1 or 2 years, but a lot of work is being done in sort of 5 or 10 years down the track.
Understand.
I would hope.
Okay. Brian's got a question for you. Go ahead, Brian.
Chris, on TV a while back, there was a report that the use of Viagra affects your eyes later in life. Is that true or false?
The issue with Viagra is an interesting one. There was a number of cases reported from the United States a few years ago of a condition that had an association with men taking Viagra. Now, the tricky thing with these sorts of things is to know whether it was caused by the Viagra or there was just an association, because obviously as you get older and men who often have ischemic heart disease or other things that cause erectile problems can also suffer similar problems in their eyes as well, and the blood supply to the optic nerve can similarly be affected. So it wasn't clear whether it was the Viagra that caused it
than causation,
or that it was a similar population group that was affected.
Okay. So maybe if you're using it, Brian, keep using it, yes, and it'll help you not go blind by the sound of it. Gail, go right ahead.
Oh, hello, Dr. Sharman. My name's Gail and I live in Nowra.
Mm-hmm. Good afternoon.
I've been attending an ophthalmologist for the last 7 or 8 months down here. I've been having injections in my right eye because it was bleeding behind the eye, and there's very little sight there. The last time I went was only a couple of weeks ago, and she told me I have macular degeneration in that eye now. There's so little sight, I can barely see out of it, and she's been giving me the injections to stop the bleeding. That hasn't happened. It's still bleeding. And I'm just wondering, is there anything else I can do? The other eye also has advanced cataract, so I can't see very much at all now.
Right. I mean, certainly the idea of the injections, there's a couple of different reasons we use them, but wet macular degeneration is the most common reason in Australia, certainly, and it's where a new blood vessel leaks and bleeds at the back of the eye.
Yes.
Now, prior to 2007, there was no treatment that was effective in improving this condition very much.
Right.
I say to my patients, look, the injection therapies, they're not miracles, but they're certainly better than anything we've had previously, and they have worked very effectively to maintain and even in some people restore vision. Now, the issue with you, by the sounds of it, is you've lost a significant part of your central vision.
Yes, I have.
And the idea of ongoing treatment won't necessarily, by the sounds of it, and obviously I'm just sort of making a few assumptions, but would be to reduce the size of the blind spot you had rather than to necessarily restore the vision. There is a risk when you have wet macular degeneration in one eye that a similar thing can develop in the other eye as well.
But would it not be also advisable for her to get those cataract fixed on her left?
Certainly on the good eye.
Yeah.
I did ask my ophthalmologist, would she operate and take the cataract off the left eye because my vision is so low now?
Correct.
And she said, no, not until we stop the bleeding in the right eye.
There was some concern a number of years ago whether there was a correlation between cataract surgery and macular degeneration progression, but certainly there's no concrete or definite evidence for that. And during my training in England, we would do cataract surgery, especially if the cataracts are enough to be causing you low vision. Yeah. We would be doing that sort of procedure reasonably commonly and routinely. So
maybe a second opinion might be handy. Graham Webb, former radio great, is on the line. Hello, Graham.
Hello, buddy. By the way,
yep.
Your program is so busy today.
Oh, it's on fire, yeah.
I also say quite compelling.
Good on you, thank you.
Yes, I've got macular degeneration. The last 3 years it's gone galloping, and now, only 2 weeks ago, my specialist said that I've lost my central vision completely. But he said there's good news. You will not go blind because your peripheral vision will remain. Yeah. Well, it still leaves me about 3 inches from the TV screen and the computer screen to be able to work anything.
Yeah, what a pain. What a disadvantage for you, mate.
Very sad to hear that you've got it, Chris.
Yeah, I know. Early stages, and I'm doing what I can to delay it.
Let me just tell you now, seriously, the worst thing that's ever happened to me is not being able to read one word.
Yeah.
Often at this stage, I mean, it's a matter of trying to maximise the vision that you have. So things like, big magnifying glasses, bright lights. There are a number of sort of things that Vision Australia and so forth can offer to try and maximise the vision you have, even if you can't restore the vision. Sometimes it's a matter of making use of what you have available, I suppose.
Yeah,
I'm sorry to hear that.
Sorry to hear that, Graham. Thank you very much for phoning in, Neil. I've run out of time, but it's terrific to have you in here.
No, pleasure, Chris.
And introduce you to the audience because I intend, if I can twist your arm, to get you back in soonish.
Yep.
And answer callers that couldn't be answered this afternoon and tell us a little bit more about various conditions.
Yeah, no, that'd be a pleasure. I mean, eye health is something that's important to everyone, so no, I'm happy to do that.
Thank you, mate. Thank you. Dr. Neil Sharma from Green Square, and we'll get him in again. Don't worry, if you didn't get to him this time, you'll get another chance down the track. This will be a busy hour because not only will I be trying to take as many of your calls and hear what you've got to say this afternoon, we've got our food and